How's it going, guys? Past level question, genetics, hematology, steps 1 and 2. Hemoglobin normal, 14 grams per deciliter, should be 13 to 17.5. Males, non-menstruating women, 12 to 17.5. Menstruating women, leukocytes normal, 7,000, should be 4 to 11,000. Platelets normal, 250, should be 150 to 450,000. Bleeding time, elevated 8 minutes, should be 2 to 7 minutes. PT normal, 12 seconds, should be 10 to 15 seconds. PTT elevated 50 seconds, should be 25 to 40 seconds. What's most likely explanation for the findings? Choice, well, these first three answers, all fucking wrong, because factor VIII deficiency, hemophilia A, X-linked recessive. This would give you an isolated increase in PTT, but we would not have an elevation of bleeding time, which we have here. Okay, so you know it can't be right. But this will classically be two vignettes. Number one, school-age boy who has bleeding into the knee, hemarthrosis. They can tell you maternal uncle had died from mild head trauma. Second vignette, pediatrics, can be neonatal boy who has excessive bleeding with circumcision. Wrong fucking answer. Choices C, well, not fucking C, choices D through F, all fucking wrong. Okay, and the reason you know they're wrong, impaired platelet aggregation, not inherited, would refer to ITP, immune/idiopathic thrombocytopenic purpura. Okay, and this is going to be two vignettes. It's going to be, number one, classically viral infection in a school-age kid, followed by epistaxis, nosebleeds, mild cutaneous findings, petechiae, easy bruising. And the second vignette will be a woman 30s to 40s who has random bruising. But in both situations, you're going to have an isolated increase in bleeding time, but your PT and PTT will be normal, and your platelet count would have to be low. That's ITP. Okay, so antibodies against glycoproteins 2B, 3A on platelets. Now, bleeding time refers to a platelet problem. PT and PTT refer to clotting factor problems. It's that simple when you're trying to learn this hematology stuff. Okay, I ask students, well, what would you expect for bleeding time, PT, PTT with a variety of conditions? And they're always confused about those things. Like, it's not hard. Well, we say with ITP, it's just a platelet problem, right? Okay, so that's why you'd only expect your bleeding time to be elevated. Nothing to do with clotting factors, is it? No. That's why you'd expect your PT and PTT to be normal. But then we talked about for hemophilia A, that's a clotting factor problem, the intrinsic pathway. So it's PTT elevation, and your bleeding time is normal because it's not a platelet issue. So wrong fucking answer. Choice is impairment of cleavage of von Willebrand factor multimers, refers to TTP, thrombotic thrombocytopenic purpura. Wrong fucking answer. This is going to be a pentad on USMLE. Granted, I didn't give you a vignette here, but we would have, your pentad is going to be thrombocytopenia, which we clearly don't have here, schistocytosis, so due to hemolytic anemia. Not to say it's mandatory your hemoglobin has to be low, but if they ever were to be audacious and give you a normal hemoglobin, they'll make it obvious there's still hemolysis. They can tell you the schistocytes straight up. They can say LDH is high. Holy shit. I've talked about how serum LDH goes up when you have hemolysis because RBCs are packed with LDH. USMLE loves that factoid. And so those are two things, thrombocytopenia, schistocytosis. The combination of those two is called a microangiopathic hemolytic anemia. Number three, renal findings. So elevated creatinine or renin or hematuria. And then 4 and 5, fever and neurologic signs. You're going to treat with plasmapheresis. Wrong fucking answer. Paucity, actually just real quick. It's antibodies against your mutation in ADAMTS13, okay? Some students get hyperpedantic that there could be a polygenic association. There definitely is not a strict inheritance pattern though, but it's usually just sporadic / no specific inheritance pattern. As I already said, wrong fucking answer. Paucity means reduction of multimeric glycoprotein, correct answer. So it's von Willebrand disease and it's autosomal dominant. And even if you had no idea what paucity meant, it doesn't matter. We can easily eliminate to get there because here in von Willebrand disease, we expect a normal platelet count, we expect an elevated bleeding time, and we expect PTT to be elevated in half of questions. Okay, so if I were to have been audacious and gave you a normal PTT, it would have been the same answer. And the way we know it's not ITP though, if that were the case, is because platelet count is normal in von Willebrand disease, but it's decreased in ITP. So the function of von Willebrand factor is to bridge glycoproteins 1B on the platelet to underlying collagen / vascular endothelium. So because it's a platelet issue, platelet adhesion, bleeding time is always elevated. But the secondary role of an Willebrand factor is to stabilize factor VIII in plasma. It's a mere secondary role and auxiliary role. And for that reason, PTT need not be elevated in all of questions. Okay, only about half of questions is elevated. It's very, very important because students will sometimes get questions wrong thinking, oh, I thought or I thought PTT had to be elevated. No, it doesn't. Okay, so only about half of questions will be elevated. So von Willebrand disease, it's going to present classically as one platelet problem and one clotting factor problem in the same patient, 9 out of 10 questions, okay? Platelet problem, epistaxis, easy bruising, petechiae, and then your clotting factor problem can be excessive bleeding with history of tooth extraction, heavy menses. So autosomal dominant, as we said, let's just hop through the final answer choice here, vitamin deficiency, wrong fucking answer. If we had vitamin K deficiency, our PT and PTT would both be elevated. So vitamin K, it's a cofactor for gamma-glutamyl carboxylase, helps activate factors 2, 7, 9, 10, anti-clotting protein CNS. So because it has nothing to do with platelets, our bleeding time we expect to be normal vitamin K deficiency. But because both the intrinsic and extrinsic pathways are affected, common pathway, that's why our PTT and PT are both elevated. But vitamin K deficiency presents 3 ways in USMLE. Number 1, classically a neonate who is bleeding from the umbilical stump. They can also say sometimes there's subconjunctival hemorrhages where student thinks it's shaken baby syndrome. But in shaken baby syndrome, they're not going to say that there's bleeding from the umbilical stump. They can be a little bit tricky that way. That's number 1. Number 2, patient who has been on a broad spectrum antibiotics, adult EG for endocarditis for 6 weeks, and they require decreased warfarin dose as a result. And then number 3 can be patient who's been exposed to rat poison, which can have a warfarin-like effect, essentially cause vitamin K deficiency. Vitamin K deficiency? Wrong fucking answer. You know the deal. I'm to make more content on your subscription. Appreciate your time. That's it.